All right, so our first question is, what aspects of ambulatory care pharmacy are the most appealing when you are thinking about how the job works?
For me, the most appealing part of my job is getting to work with the patients every single day. I have a lot of autonomy, so I see the patients, they're my patients, and I get to follow up with them regularly, which is awesome. Seeing that the changes you make over time really do make a difference is probably my favorite part of the job.
Awesome. So switching over, what would you say would be the least appealing or your least favorite aspects of the job?
Ooh, I'll be honest, I love my job, so there are very few unappealing aspects. One thing that's an issue, I think, anywhere that you work in a healthcare system is documentation. It feels like you spend a lot more time writing notes than actually doing what you need to do. It hasn't been so bad in this current role, but I know a lot of other clinical pharmacy jobs, it really adds up the time you spend. So still worth it in my opinion, but one of the downfalls.
Hey, that's good. And it's great to not have very many things you don't like. So, all right. So, what advice would you give us as pharmacy students um, when we're considering selecting ambulatory care as a pathway?
Ooh. I think having like a residency track to mind during pharmacy school would be important. There are ambulatory care jobs you can get without a residency, but they're a lot more difficult, particularly within the VA. It's really a way to get your foot in the door. When you start doing your rotations, definitely select ones, if you have any choice at all, that are ambulatory care focused, if that's something you're interested in. So you get a close up, hands on experience. Um, I think the VA is one of the best places to work. If you have a VA near your hometown, if you'd be interested in doing like a summer internship there, or really getting any kind of hospital experience is probably better than retail, unless you can find a retail pharmacy that also would give you a little bit of that. So if you're working during school or during the summers, trying to find jobs or positions where you might get a chance to interact with that. I was at Fruth when I was a student, and they have like a somewhat MTM clinic where they would do diabetes and a couple other things. So that was the first place I really saw in care, and I really liked it.
So for the next question, as far as patient interactions, how much time would you say out of your day you spend seeing patients?
I see patients the majority of my day, either face to face or on the phone. We're scheduled for about 6 hours of appointments in an 8 hour day, 30-minute appointments, 15 for finger stick INRs. I know some of my colleagues see even up to 8 hours a day, but personally, I have a little bit shorter appointments because warfarin doesn't take as long. But definitely about 75% is spent either talking to or reaching out directly to or seeing the patients face to face.
Kind of based off that question, so what does a typical day look like for you?
Gotcha. I come into the clinic, get everything set up. I have a patient schedule that prints out every morning. It tells me who's on the schedule and which appointment blocks that day. Depending on the day, it might be every appointment's taken, or I might have some free time between. So patients come in for their appointments. They check in at the front desk. I go out and get them from the waiting room. For warfarin appointments, I'll stick their finger, get their INR. We'll talk about monitoring questions, especially if their INR is out of range. We'll go over possible reasons that it could be. In between patient appointments, I also get phone calls, either inpatient doctors or clinic doctors in the outpatient side who have questions about, like if you're on a blood thinner and you're having a surgery, we get a lot of consults for that. New starts on blood thinners, so they just found AFib in the ER and they need someone to counsel the patient, pick the right blood thinner, and get them started. We do consults as well, the non-formulary drugs. The pharmacists review everyone that's ordered through the VA, which is a lot of the blood thinners, as well as some other stuff cardiac wise. So in the downtime between patient appointments, I'd be reviewing a consult or getting ready for the next appointment. It can be busy some days, it can be not so busy because we do allow a lot of time in between appointments in case something comes up, because a lot of times things do.
Awesome. For our next question, as far as ambulatory care, what made you choose the specialty in pharmacy?
Oh gosh, I always liked working with patients. I worked at Fruth since I was in high school and I liked talking to them. I liked when I started going through pharmacy school and knowing the answers to their questions and seeing that you can actually like help people by, providing answers to their questions and counseling. Um, as I had more rotations, I had Dr. Acree. She does some warfarin, she does diabetes. I really liked her rotation. I didn't actually know anything about the VA until I started telling people, in preparation for mid-year that I was interested in AmCare, and they kind of told me more about the VA system. Within the VA, we have like the widest scope of practice, I would say, of any clinical pharmacist. We can prescribe anything within our scope. So as an anti-coag provider, I can write any anticoagulant, antithrombotic, stuff like that. Diabetes wise, pain wise, we have a lot of different specialists. So it's not all just blood thinners. I did pain pharmacy before this, and anything non-controlled I would write with my name on the prescription. So it's pretty awesome. You don't have to consult with the doctor before you make the plan. So seeing that autonomy within the VA is really what made me decide like that was the part of pharmacy I wanted to go towards. And I saw a lot of it during my residency at the VA.
That's awesome. I didn't realize how much like control you were actually in charge of when it came to your job. So that's awesome.
Yeah, that's something new.
It's amazing. Yeah, nobody told me about the VA when I was a student. So I was like, I need to tell everyone. It's the best job ever.
Thank you.
We already talked about, you said doing things like trying to get experience at certain rotations and stuff. What else would you suggest that we do to get prepared for like looking for residencies or going into AmCare?
For residencies, it may be a little bit different. Definitely keep your grades up and get involved. When we screen residents here, we interview all the residents that apply every year, and I'm part of that panel. We look at research experience, so try to get something going with one of your professors, anything that you can find that's going on. Leadership roles are important too, so don't just join SNAFA or APHA or whatever. Really try to get involved. Even better if you have like an ambulatory organization. I'm not sure what all you guys have right now, but something like that. Get health clinics under your belt, get educational opportunities, anything that you can, and put it on your CV. Make sure it gives something for people to ask you about in interviews, and then you can really tell them about your experiences and your interests. Otherwise, I would say definitely shadowing professors, talking to professors in that field. I know you guys have quite a few AmCare professors, and reach out to them, tell them you like to come see a day at their clinic if you get a chance, or even just have them, go through what they do in their job and what they like and what they dislike, just like this. Dr. Acree is a great resource, and I'm sure there are a bunch of others as well.
So for the next question, what would you say would be the best characteristics that a good ambulatory care pharmacist should have?
You should like talking to people. If you're not comfortable talking to people, get out there and do it more, talking to the patients. There are definitely days where talking to people is frustrating. Either they're upset or they don't want to listen to you. But just having like the attitude that you're there to help them and having a positive mindset going into it. I like bantering with the patients, listening to their stories, hearing about their gardens and their grandkids as well. So some people really just don't like that patient interaction, and that's okay. But if you're one of those people, AmCare is not for you. So that would be something just to know. Well, can you repeat the question?
Good characteristics.
Characteristics. Okay. You do have to be pretty timely. Like with my appointments, I try not to be late for the next patient. On a busy day, that might mean you have to leave notes until later and catch up on them on lunch. That doesn't happen too often, but it does happen. Just making sure that you can stick to a schedule. It's not, I don't know. I don't like jobs where you have to find out what you're supposed to be doing every minute of the day and create work. So it's definitely more of a scheduled job. Otherwise, just thinking on your feet. Sometimes they'll ask you questions you don't know the answer to. Knowing when you can give them a guess and explain it well. And counseling just in general, putting things in patient-friendly language is important.
I will work on those.
You'll get there.
So like, what are your hours each week? What is that like?
I work Monday through Friday, 8 to 4:30.
That's awesome. I love that.
And I get 15-minute breaks in the morning and afternoon and a 30-minute lunch. So the VA is hard to beat, plus no holidays. It's basically like working in a doctor's office. Yeah, when I worked in retail, it was, everybody did 12-hour days and the pharmacists ate lunch standing up. So this is definitely a big difference.
Oh,
Right. And if you're in like the ER setting, you may not work 8 to 4:30, but I'd say most clinic jobs and especially aim care jobs are going to be like a set schedule. So thinking way ahead, if you want to have a family, that kind of thing, or if you're married to someone who has a regular 9 to 5 job, it makes it a lot more convenient than having to do rotating shifts, night shift, that kind of stuff.
right. And kind of transitioning into that, and this is the last question, by the way. So how do you balance work life with your personal life?
I actually, that's a huge part of being a student and a resident for sure. As an adult, it's definitely easier. So you go to work and you're done when you leave work most of the time. I do have a laptop. I can work remotely. Sometimes I do have to come home and finish notes after work hours, but just trying to get everything done at work and leave work at work. Don't log in at home. Don't put yourself in the position where you take on more than you can handle and end up having to let it spill over into your regular life. And I also think the VA is great about that because they're really, I've never been asked to work overtime without being paid for it. So the workload is pretty good. But yeah, for students, residents, the next 6 years of your life, whatever it ends up being, you're going to have to be really good at managing time. And I think those skills definitely, once you get out of training and you're actually working, I think it's good to have the skills, but it gets a lot easier for sure.
I'm excited for that day to come for
Yeah,
sure.
I think we're learning the hard way how to time manage right now.
We are.
Yes. Well, learn the skills now and you won't have to struggle later. So
Yes. All right. That was all our questions and everything. So thank you so much for answering all our questions and everything and taking your time. We really appreciate it. So thank you again.
yeah, it was good to talk to you guys. Hopefully, I wish you luck getting into an AIM care job one day because it really is the best.